childhood disintegrative disorder. I'm going to go through this as if you were reading the actual pamphlet. So right here would be the front of it, and then if you open up it on the inside, and I'll just start from the top. Characteristics and features of CDD. It's characterized by normal developments until at least 2 years of age, and then the child experiences severe regression in previously acquired social, motor, and language skills. Regression occurs around 3 to 4 years old, but I read it can be up until 10. The regression usually lasts for weeks to months, and it usually affects other developmental areas as well. The hard thing about this is that once the skills that are lost are usually not regained. Actually, there was multiple references saying that sometimes children are speaking in full sentences before this regression starts, and they never quite get back to where they were. CDD is very similar to autism. It's actually included in the umbrella term for autism spectrum disorders. The reason for that is that after that initial regression, CDD can look exactly like autism, like a very severe case. So to actually be diagnosed with CDD, they would meet the criteria for ASD, but the difference is that there has to be that typical development until 2 years old, and then they have to have regression in previously learned skills. The different signs and symptoms for child development, the social emotional, well, all 5 areas, they all start off with typical developing skills until age 2. And then you have the regression in basically every area. So for social emotional, that might mean lack of play and loss of once acquired social skills, and then an inability to establish or maintain relationships with peers. In the cognitive domain, typical developing skills until age 2, and then a loss of interest in objects and the environment around them, loss in adaptive behaviors, and then also the diagnosis of intellectual disability. And then for language and literacy, again, typical developing skills until age 2, and then they can actually regress so far as they lose all spoken speech they once had, and then as well as the ability to comprehend and use language. Physical and motor skills, typical developing skills until age 2, and then for children who are a little bit older, or maybe just at 2, there's that loss of bowel and bladder control, which would show up with like potty training would be a skill that would be completely lost. And this is where they also start to show the restricted and repeated movements that might be similar to autism as well. And in the sensory domain, typical developing skills until age 2, and then all of a sudden having unusual responses to different sensory properties of the environment. The causes and prevalence of CDD. The cause of CDD is actually unknown. It had been linked with a couple different brains, like they had looked at brain scans, and children that were diagnosed with CDD had abnormal brain images, but that's the research is very very sparse. The CDD itself is really rare, with prevalence rates of about 1 in 100,000. Usually it's boys that are affected, and the ratio of boys to girls is that are diagnosed with CDD is about 8 to 1. And then also all of these, they're all estimated because since CDD is so similar to autism, and especially after that regression, it will present itself exactly like autism. Most times people go back to just diagnosing autism. But they could be diagnosed with CDD if there was that period of normal development followed by the severe regression. For major services, there isn't any differential treatment for children with CDD. The services provided are usually the same as for children with ASD. So these can include placement in specialized care in an autism treatment center, occupational therapy, physical therapy, speech language therapy, sensory integration therapy, play therapy, family therapy. That was a huge one. As I'm sure as you can imagine, having a typical developing child go through this severe regression has got to be just heartbreaking. So it's really important to support the family as they go through this, and then some biomedical treatment. On the back, find different medication options. Again, they're similar for those with ASD, and they're focused on mainly controlling seizure activity and then improving behavior and attention. And they could be antidepressants, stimulants or non-stimulants, antipsychotics, benzodiazepines, and clozapine. Strategies used for teaching children with CDD are about the same as those for teaching children with ASD. So just a couple strategies that are really big ones would be using visuals to communicate. Obviously, if they've lost their ability to understand speech and or to speak themselves and also understand language, visuals is huge. Using social stories, using behavior modification interventions like the applied behavior analysis, reinforcing desirable behaviors and extinguishing undesirable behaviors, and then also social skills training. Resources for family. I have it written right here. Since CDD is rare, there's limited information available. Autism, which occurs more frequently, is usually used as a guide for the parents. So I've got the ARC Minnesota resource listed there, the Autism Society of America, the Mayo Clinic, the Minnesota Autism Center, which there's one located in Mankato, and that's a separate educational facility for students with autism. The National Information Center for Children and Youth with Disabilities, and then some literature for parents, Children with Autism, A Parent's Guide. Yeah, so if you have any questions, please feel free to shoot me an email. Otherwise, I'm really looking forward to learning about the disabilities that you all researched. Bye-bye.